questions and ideas. Oh, here we go. Hey everyone, welcome. It's great to have you, and thank you all for joining us on the live stream for Keys to Food Procurement, Getting in the Door for Institutional Food Rescue. I think you'll really enjoy this panel. We have very different perspectives to share, people coming from very different sectors, and it's exciting to have you all join us. We're going to just do a quick round robin and have each person introduce themselves, tell us a little about themselves and the organization that they're representing. Mia, if you want to kind of jump in there.
Yeah, absolutely. So hi, everyone. My name is Mia. I am a senior project manager at Compass Group, and Compass is a global food service provider.
And Mia, can you share with us some of the sectors that Compass covers? I know there's a long list, but people may not recognize that name, but they may recognize the others.
Absolutely. So Compass has dozens of sectors. We do healthcare, corporate cafeterias, college campuses, and some of those sector names include Morrison Healthcare, Touchpoint Support Services, Levy for the stadiums, Chartwells, and Bon Appetit Management Company are some of the big ones.
Awesome. Thank you. Lauren, go right ahead.
Hi, everybody. My name is Lauren Poor, and I'm a program manager with Healthcare Without Harm. And we work with healthcare in their sustainability journeys. So I'll talk a little bit more about that, but I'm excited to be here. And food waste solutions are obviously one of the key ways to engage with healthcare. So looking forward to sharing.
Thanks, Lauren. And Nick?
Yeah, hi. My name is Nick Goodfellow. My pronouns are he, him. I'm the sustainability manager for business, hospitality, and auxiliary services at the University of Pittsburgh. So I manage sustainability initiatives across many of our business operations, including dining, and have a bit of a history in dining sustainability on our campus.
Awesome. So we're going to just start out with Mia, if you want to go ahead and share a little bit of your information and tell us a little bit more about what you're doing with Compass.
Yes, absolutely. So first, I'm just so happy to be here. And I know everyone keying into the conference is doing amazing work. So thrilled that this is happening. Just wanted to give a bit more about my background and the work I'm doing with Compass and how we've been able to partner with various organizations. So I'm the senior project manager at Compass Group. And as I mentioned, Compass Group is the leading food service provider in the US and globally. I work specifically on the sustainability team. And so all things food and sustainability falls into my purview, but I've had a really big focus on food recovery and waste reduction, which I'm super passionate about. Back in 2011, when I was a college student at the University of Maryland, I co-founded Food Recovery Network. So I've really been able to bring that in to the work I'm doing with Compass. As a college student, when we were starting FRN, we were just so aware of the need locally and then the abundance of food. And I know this is a story that's so familiar to everyone, but just the abundance of food on campus. We started out with, recovering food a couple nights a week and donating it and seeing that there were just hundreds of pounds of high quality, nutritious foods that would otherwise just be going to waste. So we really thought, there could be a solution here with college campuses, which led to the formation of Food Recovery Network as the national nonprofit that it now is, nearly at 200 campuses that have donated over 10 million meals that would otherwise be wasted. So I was at Food Recovery Network for a while, and just with growing that and seeing what was happening across the country, really wanted to expand my knowledge beyond college campuses and got connected with Compass Group. So in 2016, I first started as a consultant with Compass. I'm now full-time, but really initially I was just understanding where they were with food recovery, supporting food recovery partnerships, and working to spread information across the company on food recovery. Still back in 2016, I think there was a lot that was coming out in terms of research. People were still getting familiar with the Bill Emerson Act. So that was my work initially. And then over the years, also trying to understand through waste tracking and site visits where waste is coming from, how we can support waste reduction. With Compass Group, our commitment is to reduce food waste by 50% by 2030. And we're really following the food waste hierarchy from the EPA. So reduction first, with waste tracking being super important, and then continuing to feed people. So some surplus is just going to be inevitable. Continuing to feed people. Last year, we donated over 700,000 meals through all of the wonderful partners across the country. And really grateful for those partnerships and to be able to do that. I was going to, jump into some of the lesson learned from the partnerships with being a national organization. Each location and each of the sectors really can just vary so much in terms of need and size. And so that means that there hasn't been a one size fits all when it comes to finding a partner. There's so much room for expanding to new partnerships and learning about the new organizations that exist, and room for innovating with existing partners. So really my goal is to provide options. So all of our locations, whether it's a stadium or a campus or a small unit, provide options so they can find a good fit with a partner. I will share my screen just so I can share some of the best practices and recommended action steps. Let's see. All right. For me, it's really been with the partners just about communication, and just from the get-go, getting really clear on what the partner does, what the mission is. Anytime you can share the specifics of your scope, your geographic region, all of that is going to be super helpful. And with that, partners that we've been able to work with closely from the get-go have been able to provide materials, and that might be a one-pager or a slide deck, or even a bulleted list via email is sufficient, just so we can reference that and understand what the organization is doing, and then share, that might be sharing within Compass Group or with the client, all of that important information. And then just we ask organizations just to share upfront the requirements and logistics. The sooner we get to the nitty-gritty of any of those requirements, whether that's minimums for pickup, limits around scheduling type of food that can be donated, it's been very helpful with solidifying those partnerships early and getting to rescue the food. So I'm going to stop my share.
Thank you, Mia. We so appreciate all that you're sharing. There's some different questions coming in the chat. So it looks like Jen's asking a little bit more about your policies and procedures around tracking waste. Can you share a little bit more about that?
So with tracking, we are measuring. So first question is inedible things like vegetable scraps, eggshells, etc. Yes, we do measure all kinds of waste. We differentiate that with tracking. For Compass Group, we have goals where everyone should be tracking, but there are options with the tool they use. So in terms of measuring waste, we're looking at weight just across the board, but everyone's using a different tool. We have our own proprietary waste tracking tool, WasteNot. So the majority of our company is using our own waste tracking, so we can track progress over time. Kimberly asks about working. That's great. Levy is awesome. So glad that you all have a great partnership there.
Yeah, I think another thing that's coming up in the following questions is really just how do they begin to collaborate a little bit more with some of your sectors? What would that on-ramp maybe look like? Is there a person to contact on that? And maybe what is the requirements that you would have for an organization? You mentioned some of those things in your talk as far as, geographic area and understanding, but are there certain safety requirements or contracts that you hope to sign with them?
Yeah, great question. So just right off the bat, if you are, a partner, I would love to meet you and talk to you. So I would be the person that you reach out to, and I'm sure we can share my contact information. I would just do an initial conversation with the partner just to learn all of the details. There's not a lot that would, write a partner off. We work with nonprofit partners specifically. We do have our own guide that we share with operators, so they're aware of food safety requirements and the Bill Emerson Act and frequently asked questions and best practices. But really, once we do that connection with the location and the nonprofit partner, I kind of get out of the way. I really want on the ground locally everything to kind of happen. So requirements really depend more on the partner than us for the most part.
Thank you. I think another thing that really stands out to me and something we've talked about in our conversations in the past has been how contract groups are really able to talk more and more with the organizations that they're contracting with, if it's a school or university or various areas, and talk to them more about, hey, we can help actually lower food waste. And we have this program. This is what we're doing. That really stood out to me that's part of the conversation that you have with many institutions when you sign on with them, and say, look, this is an advantage that, and you really talk to them about, we can bring this to the table for you. Can you share a little bit more about that? Because I think that's something that makes you stand out with some of the work that you're doing. And it's a competitive thing. Sometimes we hear the opposite, which is like, are people actually rescuing and what does that look like? And you're putting that at the forefront. Like, this is important to us. This is why we do it. And this is actually an advantage to your organization. Would you share a little bit more about that?
Yeah, absolutely. As I mentioned, just the waste reduction piece is so important, but it can be so hard to get it down to zero, especially with these large operations, stadiums, events. So I think really the important piece is finding ways to be aware. Waste tracking is a piece of that puzzle, but I also find that when locations have food recovery and when they have composting, it's just another layer of awareness. So I think the more information you can have about food waste, the better in terms of making improvements over time. And then just, I think I've said this a million times, but some of it is just inevitable, which is why having those partnerships in place is so helpful. We have organizations that, do a regular schedule with their donation just because it makes sense. But sometimes it is an irregular on-call. We had an event that was canceled or something was rained out. And having those partnerships in place avoids, the problem of food waste in those situations.
Yeah, that's a great point, because a lot of times when things occur, if those tracks aren't already laid, then inevitably it does get wasted. Whereas if that's already set up and everybody already has those relationships, that's a great point. And your role really being to make those connections and then allow that local organic relationship to develop a little bit more is awesome. Thank you so much, Mia, for sharing. Lauren, we're going to head over to you to hear a little bit more about what you're doing.
Super, thank you. I'm going to start by sharing my screen. So let me do that and make sure everybody can see it. Here we go. Go into slideshow mode. Can you all see that? Yeah? Great. Okay, I see some thumbs up. Okay, awesome. Great. Well, hello, everyone. My name is Lauren Poor, like I said before, and I work with Healthcare Without Harm. And just for those of you who are not familiar with Healthcare Without Harm, I'll give you a little bit of an intro. We have two parts to our organization, Healthcare Without Harm and Practice Green Health. So Healthcare Without Harm really creates change among hospitals and health systems through sustainability research, innovation, education, and piloting solutions. And Practice Green Health is our membership arm. So it is the leading nonprofit leadership and networking organization for sustainable healthcare, delivering environmental solutions to more than 1,600 US hospitals and health systems. So you can see on this map, you can get a sort of sense of the scale of our network. And we have programs that focus on medical waste, safer chemicals, green buildings and energy, healthy food. There's some waste management happening on my block right now. I hope that you can still hear me, but it is trash day in Los Angeles. So excuse me for that. We also have sustainable procurement programs, climate and health, transportation, the whole sustainability sector, really. So since we're talking about food today, I wanted to focus in a little bit on our food programs and our food guidance and sort of how we steer hospitals in different directions. I've included our website here, so if you're curious about these, you can go right to this website. We recently have updated our guidance around food, and so you can see sort of how we organize the way that we are advising our health systems. I'll just cover a couple of these. Foundations for Success, which really gets at, how do you build a strong base for your food work within a health system or hospital through program planning, engaging staff, and then relevant to this conversation, community engagement and collaboration. How do you set yourself up for success there? For food purchasing, how to purchase locally, sustainably, and equitably sourced food in order to really increase the quality of food served at a facility, as well as to support your local producers in your community and build a stronger regional food system. We've got guidance on the plant-forward future and how to reduce climate impacts through plant-forward menus, and healthy food environments, how to increase the healthy food environment within the hospital and outside. Today, we're going to be focusing on food waste solutions. And then we also have a section on nourishing communities, and which focuses on improving healthy food access and food as medicine programs. So why tackle food waste in healthcare? I'll just start with some sort of stats here to get us all grounded. US healthcare institutions generate an estimated 3.5 million tons of food waste each year. And eliminating wasted food in the US healthcare sector would avoid generating CO2 emissions equivalent to taking 8 million cars off the road annually. We know that healthcare must address the social determinants of health in their communities. And obviously, food security and nutrition security are determinants that are very central to that work. State and municipal policies on food waste diversion for large food providers are becoming increasingly common. I live in California. We have SB 1383. So hospitals bigger than 100 beds that have an on-site cafeteria have to reduce the food waste that they're sending to the landfill, and they have to donate that food. So these are conversations we're having regularly with hospitals on how they can do that. And then hospitals are actively working to reduce their scope 3 greenhouse gas emissions, and food waste is an easy access point to these goals. So I'll share a little bit about those emission categories, just for those who aren't familiar. The healthcare sector's greenhouse gas emissions make up 8.5% of the US total. So if it were its own country, healthcare would rank 13th in the world for greenhouse gas emissions, which is more than the United Kingdom. So hospitals and health systems are recognizing that climate change is the greatest threat to public health of our time, and that addressing their scope 1 and 2 greenhouse gas emissions is essential. They're building energy efficient buildings, they're capturing waste anesthetic gas and seeking alternatives to fossil fuels for their energy use. However, the greatest source of a healthcare facility's greenhouse gas emissions is those scope 3 emissions. And food waste falls in the scope 3 category you see here with the waste disposal. So this is a great opportunity and need to focus on reducing wasted food in the healthcare sector. As I mentioned, we have a food waste solutions toolkit for healthcare, and that's really supports them in their journey for reducing wasted food. It follows the EPA food recovery hierarchy and provides guidance at each level. And it includes case studies and strategies for each of the levels of the hierarchy. Since we're focused on food rescue today, I wanted to highlight a pilot that we did, and I'll start off with this quote from Jack Brzee, who's the Regional Director of Food and Nutrition Services at Sutter Health. He said, "Not only does this project impact greenhouse gases by keeping food waste out of the landfill, it's also about dollars saved, which is important to hospital administrators. And then there's the food rescue piece, which is what is really important to our community." So that really gives you a sense of that triple win, and what is driving healthcare to sort of deepen their food waste strategies. So I'll talk a little about this pilot that we did with Sutter Health. So from January 2020 to February 2021, we worked with Sutter Health's 10 hospital facilities in Northern California in what's called their Valley region, in a grant-funded food waste prevention and edible food donation pilot program. As you can see, based on the time frame, we started right before the pandemic. And so the work really centered and focused on donation. We didn't get to as much of the prevention side of things, but they really, we did a bunch of interviews afterwards and commented, wow, we're so glad we had this in place as the pandemic started, because they found that it became even more important. The participating facilities donated almost 65,000 pounds of food to more than 40 area nonprofits that were all within less than 5 miles, or an average of less than 5 miles from each facility. And we used Copia's tracking and donation services for that. That was the logistics company that Sutter Health wanted to use, so we went with that. And the pilot also led Sutter to expand their food recovery program to additional facilities within the Sutter Health system. And they have continued the program beyond the grant cycle. They continue to say, wow, this is amazing. We're so glad that we do this. So you can see here in the photos how excited everyone is at the various facilities. So I wanted to share just a little bit about what's coming out of what we found was the most common food category types for donation based on this pilot. So you can see here that the sort of tied for most donated were the soups and stews and the cooked starches. So these are prepared foods, really is the takeaway here. Cooked vegetables and vegetarian entrees, and then there was some meat and dairy, very little bread. We see with healthcare that the biggest opportunity is with prepared foods. And, there's obviously like significant variety depending on the hospital size and what type of facility it is. So this really sort of highlights those early coordination conversations with the health system are really important to make sure that the volume and type of food that's available is a good match. And then I'll close here just with some opportunities for collaboration, just sort of putting things in perspective. So, in the food services side, food donations is an amazing way to work with the health system, supports the goals of the health system, and also provides delicious and delicious prepared foods. Also, there's within a health system, there's community benefit, and there's every 3 years, nonprofit health systems are required to do community health needs assessments. Some of you may have engaged in these assessments in the past. These assessments are used to identify the most pressing needs in a community, and then they develop plans and strategies based on what is identified in these needs assessments. So really the best way to ensure that food gets identified in those assessments is to make sure that community food organizations are involved in the assessment process, and that questions around food needs are being asked. Because if questions aren't being asked and people are not involved that know the nuances of these things, then they're not going to be identified as top needs. And then the implementation plans and resources that go with those are not going to be going to the right places. So we did a research study a few years ago on how community benefit programs were addressing food and food environments, and found that, as you might expect, involvement of food-related organizations in the need assessment process was strongly correlated with facilities having a community benefit program that would address healthy food access and food insecurity. So that's another way to engage is in these needs assessment groups. They have steering committees, they're doing interviews, all of that. So that's just a great opportunity. And I've included a link here to this Delivering Community Benefit Healthy Food Playbook, where we have examples of, again, we have more case studies that kind of, it shows how health systems are working in different capacities with food organizations and can kind of help find entry points for collaboration. So I'm assuming that the slides will be shared after this, and I can also just drop these links in the chat. And the last piece here is really just looking at a hospital's anchor mission. So more and more hospitals and health systems are really embracing their role as anchor institutions in their communities, and they're looking at all their assets and how all of their work, what they buy, who they hire, et cetera, is supporting the larger mission of building community health and building community wealth. So these, the anchor mission is another sort of more zoomed out way of engaging with a health system. I've included this guidance that we recently developed called Anchored by Healthcare, Strategies for Health Systems, which is a resource for healthcare anchor institutions to really deepen their engagement with community in achieving goals of equity and resilience. And again, these are examples of how they already are. So it can be a good way of understanding, okay, how could my organization fit into this? How can I work with a health system? What are their priorities? And what might my role be here? So I'll just close to say thank you, and just that healthcare is joining organizations across the country to reduce wasted food by 50% by 2030. And to do this, they need partners like you. Please reach out with any questions or to continue this conversation. I've got my info on here and my email, and I would love to take any questions that are coming up now as well.
Thank you so much, Lauren. You brought up amazing points, and I love the work that you're doing. I think it's such an important thing. Health systems are doing really interesting things. We talked about this in an earlier panel, but one of our food rescue organizations actually launched their food rescue through funding from a health organization that did a community needs assessment and actually saw that, oh, food insecurity is our largest, most pressing need. So is food access. If we're going to really look at this, how do we make food within reach? And they actually utilize some of their resources to fully fund their ability to not only get software with Food Rescue Hero, but also years of extra support and marketing, and then they volunteered with it. So it was fully integrated. It was beautiful. And I love the work that you all are doing to sort of fully integrate. I'd love to go back to the community needs assessment, because this is something I talk about a lot coming from healthcare. And it's not something that I think a lot of the organizations and individuals listening may have been quite as familiar with. The thing that to me is a game changer is you really have access to so much demographic information, so many hotspots of where in your city or your county might there be higher points of need. What are the comorbidities? Where's diabetes really at a high rate? And what could you do maybe to make a change in that space? So if you could share a little bit more about the data that they could leverage from the other side of it, from the report. And then there are a bunch of questions coming in too about how do they get more involved in that community, the report itself and being a part of that. So if you want to jump in on that.
Yeah, so let me make sure. So data that they can leverage to make the case for, are you saying for
so really,
food access?
Right. So really the data that I'm often encouraging individuals to use the community needs assessments for is, one, where are the needs in your environment? Like, in really being able to do a deep dive that's very, sort of clearly laid out, but also really being able to then utilize that to report beyond the pounds is the way that we like to think about both quantitative and qualitative reporting, to where you can actually see, like, what does food insecurity really look like? Because that's being measured in a lot of these documents, and the health systems are actually doing that work. So you don't have to kind of go back out and reinvent the wheel. This is where radical collaboration can make such a difference.
Absolutely. Yeah. I'm wondering if I'm able to drop anything in the chat. I don't see, can I chat as a panelist? Because I've got some links that I would love to put in here that have a bunch about the sort of the data side, engaging community in that needs assessment.
Yeah, if you want to send it on in the group chat with this, or the studio chat to Patrick, he'll drop it right in.
Studio chat. Okay, great. So I'll start off. Yep, because I'm seeing folks are interested in these links. So There we go. Yeah. So this first one is delivering community benefit, the healthy food playbook, that one that I was mentioning. And this really goes a deep dive on the community health needs assessments, who's doing them, why, who they're reaching out to, who they're engaging, and maybe not. And then it goes into, sort of like who to engage, who within the hospital is doing this work, engaging with food policy councils. There's a whole bunch of stuff in here, different resources, case studies. And then we also there's some like statistical analysis of what we found when we were interviewing the various people who were doing these needs assessments. And then, what goes into the implementation strategy, because whatever is identified in the needs assessment is going to come up they're going to develop an implementation strategy that then dictates, okay, this is what we need to focus on for the next 3 years. This is who we're going to engage in that. And this is where the resources are going to go. So that assessment phase is really important. And I'm seeing, I'm going to go back to the audience chat. Sorry, I'm a little bit new with WebEx here. And I see Casey, hi, who has asked about the best person, department, et cetera, to contact within the city or county to learn more about the community needs assessment timeline. That's a great question. So public health departments also have to do community health assessments. So I would say reach out to the public health department. Within a health system, the community benefit, there's like a population health or community health. It's going to be different within each hospital, but usually they have that information publicly available. So they're required to have it publicly available. So you can go on the website. You can go on the website of a hospital and see where the community health needs assessment is, who's in charge, and reach out that way as well. So I hope that answered your question.
No, very helpful. And I think it is a rich source of information that I often point individuals in hunger relief and food rescue to, because these are questions that often we're asking, where should we be? Where should we focus our energy? What are some of the things? And how do we measure beyond the pounds to where we're able to see if the work that we're concentrating right in this zip code has been happening, we should start to see that number move actually, and what this looks like as these other organizations are measuring as well. So it is an exciting way of using that and staying within the community and engaging with it. Thank you so much for the work that you're doing with this. This is so exciting. Nick, we want to head over to you because you've got such great things to share, and you have a rich history with both 412 and food rescue as well. So jump right in there.
Yeah. I'll tell you a bit about our history of food rescue on campus and some of the trends that have come out of that really relate to what both me and Lauren have talked about. So our food recovery effort started in 2014 when students who were on campus noticed that, a lot of food was being uneaten and being thrown away. So they started working with our food service provider at the time, Sodexo, to try and rescue that food. And that was a pretty lengthy process to convince the food service company at that time that there was the Bill Emerson Good Samaritan Act that protected them, and that they could do it safely. And so at that time, I was an intern for Sodexo. I was also a student. And we were very fortunate to be like 2 miles away from the Food Rescue Hero 412 Food Rescue Office. So we'd stop by and ask questions and use them all the time. Let me actually go back and give some context. The University of Pittsburgh is a higher education institution with about 30,000 students in Pittsburgh, Pennsylvania, and we're a state-related institution. We have about 30,000 students, 14,000 faculty and staff, and serve about 30,000 meals a day. So at our scale, the food waste, is pretty substantial. So with 412 Food Rescue and Food Rescue Heroes help, and then connecting to the Food Recovery Network, we were able to get a few recoveries underway, and really ramped up recoveries the next year once the dining staff understood how the practice works, how to do it safely, where the food was going. And we became a food recovery verified campus in 2015, which is a business donor certification through the Food Recovery Network, which really helped institutionalize. Well, it was sort of the first step in the process of institutionalizing food recovery on campus. Our students just kept going at it. They started with baked goods at Einstein's and coffee shops, and then expanding to our dining halls, which serve, meals, and the surplus food is pan size and half pan size, so quite large volumes that they're rescuing, to game day events. They won various awards from the EPA and Zero Waste Excellence Award from Pennsylvania Resources Council. At the same time, on campus, we started having very serious discussions about basic needs, and in part because of the work that the students were doing to recover food, really bringing this topic to campus. We don't have an agriculture program. We don't have a food studies program. So food really wasn't a big part of the campus culture. And when students began recovering food, it really started, the conversation on campus. So in 2015, our campus started our own pantry, or our basic needs addressing pantry. And then in 2020, during the pandemic, we switched our food service contract to Chartwell's, which is part of the Compass Group. And in that, we actually built in contract language around food recovery, which I think at the time was pretty needed. But, based on what I've seen now and what Mia's talked about, it's pretty common in a lot of the food service organizations to do food recovery. But we were very serious about it, and we wanted to make sure that it was part of our food service contract. A year later, we did the Real College Survey, which is a survey of basic needs at the university. And it's a national survey that universities, higher education institutions can enroll in. And that was the first time we had actually measured basic needs on campus. And the report found that 43% of our students during the COVID pandemic, the first year of the pandemic, had experienced some form of basic needs, and 18% of them had experienced some form of food insecurity. So it was really foundational and important for us to have that understanding, because we had been wondering why we're sending so much food off campus when we know that we have a student population that is struggling to meet their basic needs with food. And so some of the work that's been happening in the last 2-3 years is to figure out how to repurpose food or redistribute food on campus in a manner that helps address our campus needs while also addressing the community needs. So in the last 2 years, the food service company Chartwell's has been working with our students on a way to repackage some of the food that is prepared and recovered and eaten from the dining hall. As I mentioned, these are like full sheets of food, full pans. They're kind of difficult to donate because you need to find a kitchen that has the equipment to reheat a full frozen pan of lasagna or whatever it is. And so what the students and the dining hall staff have done have begun sort of breaking down those meals and repackaging them into individually sized meals, cooling those off and transporting them to the pit pantry where they can basically donate a complete meal that was made from different parts of what was recovered across campus in a safe manner. And we're now working to launch a program. So those have been going through the campus pit pantry. And we're now working to launch a program where we do food delivery and food sort of parcel locker pickup in some satellite locations on campus to further address the student food insecurity need. So those meals then get transported to temperature controlled lockers where a student can pick up their meal from the locker at their convenience, along with other food delivery meals, so that we can also help sort of reduce any stigma or address any concerns that somebody might have around privacy in dealing with that. In terms of how the university sort of has embraced food recovery, to Lauren's point about anchor institutions, that's definitely been something that the University of Pittsburgh has been really embracing in Pittsburgh. We just hired a vice chancellor of Anchor Institute or Anchor Initiatives, and food recovery has been highlighted in the university's community engagement report recently. And the students are really passionate and very excited to be working in the community, which has been one of the, I think, benefits, one of the advantages of this program and what's really helped institutionalize food recovery on our campus.
Thanks so much for sharing, Nick. This is it's just exciting to hear how even your personal passion has sort of developed into really this impact all across the university. And we always think about a lot of these institutions as, you know, hubs of not only great volunteers, access to food, sometimes, you know, additional resources and access to funding, but also, you know, really being this collaborative place where community and individuals can meet and kind of bring this together. One of the things that you mentioned is the lockers, which I think is really innovative, and I love this. This has been coming up all through the conference. We've talked about community fridges. We've talked about food hubs where they're using repurposed sort of crates or other, you know, larger refrigerated areas in order to bring this access. And really it being a place of food dignity where individuals can come, they can engage with that, and it's accessible. It's part of their route. I think there's something so dignified about having the convenience, right? Of just like walking by a locker that would be on your route home towards your dorm room or your apartment. Can you tell us more about how you got that set up, what that looks like logistically? Because I think that's a fantastic model too that you all have implemented and you're starting to build out.
Yeah, we're still working on the implementation of the locker. We got delivery of them like a couple weeks ago. That's great. So they're sort of plugging things in still. But it's been sort of a component of how we move away, but evolve our approach to food insecurity, addressing food insecurity in the pit pantry. You know, for a while we were focused on getting the pantry up and running, and then we thought like this should be front and center on campus, and really normalize it. It's a grocery store, and it happens to be low cost or free. Meanwhile, we're also, you know, we have implemented food assistance programs that allow students who apply to the program to get meal passes so that they have the normal experience like every other student on campus and can swipe into the dining halls. And so the locker is sort of the next evolution of that. And it's a locker not just for the packaged pantry meals, but also for food delivery. So our Chartwells is working on food delivery on campus. And so it's not necessarily the food insecurity locker, right? And if you're a student walking by, you don't know what that person is picking up. So it could be recovered food. It could be, something that they ordered from Wicked Pie pizza place on campus 20 minutes ago. So it's really exciting, and really applaud our students and the Chartwells for working on such a great program.
That's incredible. So do they swipe to open that locker, or how do they get access to the particular item that they've?
Yeah, it's a mix of swiping and an app. I don't operate the locker, but it's got a lot of fancy technology. It's very much like an Amazon sort of delivery locker where you've got like a code and you pick it up.
Yeah, and kudos again to Compass for bringing that into fruition, because of course that is its own journey, and it takes really good collaboration, right, to get that up and rolling, even with the vision and desire that Pitt has had to make that happen. One other thing that you mentioned. I feel like the biggest takeaway for us has been building relationships. That's been so key to making a lot of this happen, whether it's a relationship with 412 Food Rescue Hero, so that we can call on them if the students are on spring break and we have food waste, or the relationship with Chartwells that the students have formed. Like, this is so key to developing the trust, because sometimes folks will come at us with a crazy idea or a misunderstanding, or there was an issue with the recovery. And because of the good, strong relationships that we've had, we understand, when things happen, and are really willing to collaborate. So I think that one of my key takeaways is really focus on building relationships, especially with the students. If they're passionate, if you are contacted by a student, mentorship approach is also a great way to talk to them about it, because they're, like Mia probably experienced, starting an organization or starting an initiative on your campus is very intimidating, and you sort of don't know maybe how to approach university administration or how to work with outside organizations. So being a mentor, being a support to the students, I think is really important when you're working with higher ed. Absolutely. Another thing that stood out for me and resonated was how you're leveraging something that might have been a logistical issue, like the large pans, and trying to break those down in as reasonable a way as you can. Are you using volunteers from the student body or departments, or is it a pantry-led initiative to do that?
Yeah, that's a great question. So it's our Food Recovery Network chapter on campus called the Food Recovery Heroes. They are 50 student strong student organization. They have too many volunteers. No, they don't have too many volunteers. They have a ton. So they have actually, they undergo a bit of a food safety training. They are given, hairnets or wear caps to go into kitchens and work with the cooks and the chefs on how to break down a pan of lasagna and the green beans and repackage it. So it's a collaborative effort with students and the dining staff who are doing that.
That's great. Well, thank you all so much. Any final thoughts that each of you might want to share with those that are attending? Nick, you brought up a great point about collaboration. I wonder if, having heard everything that everyone shared from different perspectives, from healthcare to what's happening at Compass to universities, anything you wanted to jump back in with? I love it. We covered all the ground. Nick, you feel like you're deep in thought here. You've got a couple things flowing around.
Oh no, I mean, there's so much to talk about with food rescue, but I think we covered quite a lot. Lauren or Mia, if you have something else.
Yeah, and so many kudos coming in over chat. Thank you all for being so engaged with the live stream, and thank you, presenters. It was excellent information and really insightful. I think a lot of times when we're doing this work, it's so grassroots, it's so gritty, it can be so challenging, and often we're working from a place of minimal resources and trying to do the best we can. And so the idea of how do you leverage already existing anchor institutions and other relationships to extend you, as well as help them to really directly connect to the community in the ways that many of the individuals who are listening do, is so meaningful. So thank you all very much. Stay tuned. There's a great content on the way. So we look forward to connecting with all of you. Oh, we've got a quick last minute. Nick, do you have any interactions with those local food pantries?
Yeah, yes, definitely. I mean, the Pit Pantry, and I'll give a shout out to Sarah, who's in the chat and who is our basic needs director on campus, who manages the Pit Pantry. Fantastic resource. They're a partner of the Greater Pittsburgh Community Food Bank, and so we work within that network. So, for instance, Chartwell's has done food recovery to the food bank. And we also, at the end of the year when students move out, we have a big material collection event to collect all the stuff they don't want to take home with them. And food is a significant, volume of items they don't want to take back. And so we work with the Pit Pantry and our Community Human Services pantry in the neighborhood to donate that food. So yeah, we do work with a lot of food pantries.
Awesome. Well, thanks again, everyone. Stay tuned. We look forward to ongoing great information coming, and thank you all panelists. You did a great job. We'll talk to you all soon.
Thanks, everybody.